So I'm calling out the no hands for folks at home with small TVs: Jim Walsh, Ian Tafoya, Leslie Herod, Terrence Roberts. Please raise your hand if you will forcibly arrest or commit people who do not agree to go into shelter or housing options provided by the city or refuse to go into treatment for mental health or drug issues.
Caveat.
So the folks that I see who are saying that they would forcibly arrest or commit those folks are Kwame Spearman, Trinidad Rodriguez, Thomas Wolfe, Debbie Ortega, Kelly Brough. Thank you.
No explanation.
Please raise your hand if you believe that most of the people living on Denver streets want to live in a home. That appears to be everyone. Please raise your hand if you believe that it is the responsibility of government to provide a home for everyone who wants it.
Shelter.
Shelter or a home, that's fair. Shelter or a home. Should the government provide shelter or a home for anyone who wants it? I believe that was everyone except for Chris Hansen. So many of you are promising a tougher stance on clearing encampments. So we're going to ask you to contrast your approach to Mayor Hancock's current approach of the homeless sweeps, the voluntary offers of shelter for people, sporadic arrests for various crimes, or involuntary detox or mental health holds for some people. None of that has solved the encampment problem in this city. We'd like those of you who say that you will end encampments to explain very specifically how you're going to do that beyond the measures being taken by the Hancock administration. And we welcome rebuttals from folks who disagree. Kelly Brough, the first question is for you. What happens under your plan when someone on the streets says that they don't want the shelter that you're offering, and there's no grounds to involuntarily commit them? Are they going to be arrested for something? Will they just be moved along as they are now? How does that work? And if people end up in jail instead of on the streets, is that an improvement in your eyes?
Yeah, I think what's really important on this issue is to recognize the majority of service providers in our region will tell you they believe the vast majority of people living on the street are going to go voluntarily to safer locations. The big issues that prevent it today are they can't be with their family or their partners or their community. They can't be with their pets. And they're not safe in our current shelters. So I'm going to end unsanctioned camping by providing temporary sanctioned locations until we can build what we need.
And then what happens with the folks who say no to that offer?
So as mayor, you still have an obligation to keep everyone safe. And so if somebody can't make that decision for themselves based on mental health or addiction issues, I still think we have an obligation as government to make it for them until they can. So I would still take them in. If somebody just refuses, I still believe we have to take them in, and I would liken it to how we do drug court today. Today, when you come into drug court, we give you an off-ramp where you can choose alternatives, but we don't give you the choice to live in inhumane conditions. I would do the same here.
So for those folks who are not going to be taken in for detox or mental health treatment, who just don't like the choice you're offering them, somebody can't be arrested for disagreeing with the mayor. What would you arrest them for?
Well, there's no camping. And what we're saying in our city is it's inhumane to allow you to live in those conditions, and we're going to change that.
Mike Johnston, you're pledging to end homelessness, not just the encampments. That's an estimated 4,700 people total experiencing homelessness, not just the 1,300 who are unsheltered. Mayor John Hickenlooper made the same pledge 20 years ago. How will you succeed where Hickenlooper failed?
Yeah, there's two things we've gotten wrong on this. One of this is the reason that the current camping ban practice of moving people is not working is because there's no place to move them. What we know is actually what these folks need are access to housing. So the way we solve this is by actually building housing. I would build micro communities of tiny homes, 40 to 60 each. We've done this and we know it works. And the reason why it works is you also allow people to move while preserving a sense of community. Right now you open one unit at a time and then you go to an encampment where 12 people are living and offer one person a house. They might say no. What we know is if you open to communities that have 40 to 60 units and you go to 2 or 3 encampments and allow those people to move together in a way that preserves that sense of community and then provides all the wraparound services people need. That means you have access to drug treatment, to mental health support, to housing, to long-term workforce training. We know that those systems work, and we know that people want that option for a safe, stable place to live. When we offered this to people, we had 300 units, 800 people signed up for them, and a year later, 86% of those people were still successfully housed. That's why we know it works.
So again, as we talked about at the beginning, privately with the candidates, this is a debate and not a forum. So we encourage you to talk with one another where you have respectful disagreements. Just let me know when that occurs. Chris Hansen.
Yeah, thanks, Kyle. I really wanted to add on to that, add on to this discussion, because housing alone is not going to get the job done. just providing a tiny house or just providing a unit is going to perpetuate many of the problems that folks are experiencing, which is why last year in the state budget, we made a huge investment in the new Ridgeview facility east of town, stable housing with wraparound services on site, get folks out of the context in which they're struggling. That's how we have success, and that's what we're seeing around the country in places like San Antonio. That's what's working. Let's not perpetuate just housing.
Trinidad Rodriguez.
Thank you, Kyle. The reality is the thing that we're not doing nearly enough of is addressing and serving, providing health care and mental health and addiction treatment services to those people who have these conditions. It's often the case that these conditions prevent people from actually accepting treatment and help. And so we need a solution that actually starts to serve this group of people. It is inhumane to continue to allow people to live on the streets in serious danger to themselves and or others. And in the meantime, the hazards are rampant. And so we need the ability to take people into treatment on an involuntary basis. I'm excited to see that the mayor has actually started talking about doing just this.
Thank you very much. We're going to get one more quick answer here. A reminder, everyone will get their own individual question on this topic because it's so important. Kwame Spearman.
So we've got to recognize that right now there are two groups of our unhoused on our streets. The first are people who are being failed by the system. And we've got to innovate, we've got to build micro homes, we've got to do more for those individuals. But we've also got to recognize that because we are not enforcing our laws, we've become a magnet for people who are exploiting the system. Now, I don't know if it's 51% or 47% or 15%, but I do know that we are not going to make progress on homelessness until we recognize that there are some people who are exploiting the system. And we've got some tough choices ahead as how we want to deal with those individuals. But that's a key part of this debate and something that I'm willing to have a conversation with tonight.
So just to follow up, we're going to ask you about this in just a moment. Not only have you said that people are exploiting the system, you've said, quote, we're creating conditions where in many cases it can be more enticing to go to an encampment than to get a job. Can you tell us how you came to that conclusion and whether conversations with people experiencing homelessness or direct service providers informed your point of view?
So Denver Homeless Out Loud, which is a far more progressive organization than I am, did a survey and said 52% of our unhoused would prefer to live in a tent than other housing options. They also said that 18% of our unhoused will only live in tents. You know, Kyle, if you think about what we have to pay our workers right now and what that means to live in the city, the transportation ecosystem that we've got in our city, you can start understanding why people are making decisions that put them in a situation where they're not housed right now. We've got to have a holistic approach to having affordable housing, to having good paying jobs, but we've also got to have laws that are enforced that deter people from living a life where they're unhoused.
Thank you. Our next question is for Debbie Ortega.
Your vision to address homelessness is revolving around resources and ending encampments by connecting people to wraparound services. But if people say no to that help and we still see camps standing in Denver, what as mayor would you do then?
So there are a couple things I would be doing different. First of all, we haven't really utilized our workforce arm to help people get back to work. And not everybody on the streets are chronic homeless individuals. For example, we've been housing people in motels and 24/7 shelters that have had their lives stabilized for the last 2 years. And I would be utilizing our workforce arm to assist those individuals to get back to work towards self-sufficiency, because our ARPA funding is going to be running out, and when that disappears, the general fund in the city cannot sustain those costs. So I want to help move them to self-sufficiency. We have programs like the Denver Day Works program that Bayard Enterprises has done, where they have actually taken people off the streets and put them to work. And a number of those people have gotten into full-time jobs, and many of them are now housed. So there are programs that work, and that's one example of what I would continue to support so that we help people get back to work.
One of the things we've heard from advocates is that we do have successful programs, but we're not successful at scaling up. So how would you do that?
I think part of it is not just a funding issue, but the reality is we have an array of training programs across our community that are private sector as well as publicly funded. And we need to pull those all together because we have employers that are dying for workers. So what we need to do is look at how we close the gap, address the needs of the individuals. In many cases, we need employment navigators to help them. And as they're getting stabilized, and in this case, they're stabilized in housing, we want to get them stabilized in permanent housing.
Thank you. Lisa Calderon, you have called the current sweeping policy mean-spirited. And you've talked about the need to meet folks who are experiencing homelessness with more outreach services. I'm sure the Hancock administration would say that that's happening now. So what would fundamentally change on this issue if you were in charge?
We would actually use evidence-based practices, and that's not happening now. And in response to some of my colleagues up here, I'm also a criminal justice professor and a 20-year service provider, domestic violence victims who find themselves homeless, people coming out of jail who find themselves homeless. And with all due respect, these folks don't know what they're talking about. If Kwame was a student of mine, he would get an F for analysis of that report. That's not what Denver Homeless Out Loud said. What they said was, basically, if it's a choice between going to shelter or living in a tent, they would prefer to be in a tent. And part of that is exposure to COVID. You know, we need to start treating people with dignity. And this is a very paternalistic responses we're getting here. I've been formerly homeless as a teen, escaping domestic violence from an abusive step-parent. So when I hear terms like those people, you're talking about me.
So I think I should be able to
respond
to this. More stats from what Denver Homeless Out Loud said is that there are more people who are chronically homeless today, in fact 4x more people than who are suffering from homelessness due to domestic abuse or due to problems with their family or due to being a veteran. And respectfully, Lisa, I think I said exactly what you said. There are people who are preferring to live in tents than to go to shelter. Let's talk about our shelter system. It is now open for 24 hours a day. It has capacity. You can have a shower there. You can put your belongings in that shelter. And people aren't going. We've got to face an unfortunate truth. It breaks my heart when I see tents outside of Tattered Cover. But if we allow those tents to stay outside of our businesses, we are going to lose customers. Ask yourself in this audience, or if you're watching this, if you frequent businesses that have homeless encampments outside of them. And if you don't go into those businesses, we can't pay our employees. And those same employees... Thank you.
Thank you. We've heard a bit from you on this issue. I want to return to Lisa Calderon just to wrap this up quickly here. You've described the Hancock administration's policies as mean-spirited. What you said about the folks up here on the stage is that you just don't think that they understand the issue. Do you sense a mean-spiritedness here, or simply you think you have expertise they don't have?
I do have expertise that they don't have. I have lived experience that they don't have. I don't think people are intentionally trying to be mean to people, but that's the impact. That's been the impact of the camping ban that has not been effective. We've had it for 10 years. We have plenty of data that shows that that does not work. What does work is actually what I would do, replace street homeless teams, street enforcement teams, with crisis intervention responders so that we aren't just leaving people out there, we are moving them into homes. I've organized with Denver Homeless Out Loud and other homeless rights organizations. We believe in master leases. So there is an array of things that we could do that we have not done and chosen not to do.
Thank you.
Next question is for Thomas Wolf. Ending the urban camping is your single biggest campaign issue. You said the city has offloaded too much of this work to nonprofits, and you say that you will confront and control encampments. Why is confrontation the way to solve this issue, and then what is the role for nonprofits?
Yeah, so, you know, the meow I referred to has gone on for 3 years. Okay, that's clearly not working. The numbers say that when you're confronting or trying to help these people, it breaks between chemically dependent, mental, and criminal, and sometimes all three, which is a really tough lift. So that you need to triage, you need to bring the right resource to bear in a different situation. Those first two it needs to be clinical healthcare workers, probably with a backup from security, from our safety, and then the criminal. Obviously, that we need to enforce law and order. We've been lax about that, so then people push that envelope. We need to basically create a truce, have an armistice with this population and say, now we are going to enforce laws. We have a new administration. sorry we didn't enforce that before. You can either come to shelter or, move on, okay? And then, but the next time, you won't have the same choice if we find you doing the same thing.
Chris Hansen, you have the other end of the spectrum of this from a nonprofit standpoint. You've told me that you want to rely on nonprofits for this topic and that you want to audit how much Denver is spending and who's getting it and what are we getting in return. So what's the city's responsible for? What is the city's responsibility to do in-house versus what you're outsourcing to these nonprofits that you're not sure if you're getting bang for the buck?
Yeah, Marshall, thank you. We've kind of left out the nonprofits in the discussion so far, so I really appreciate the question. I've had a chance to spend time with some of the great nonprofits in this city. They are doing amazing work, and I had a chance to spend a day with the Salvation Army last fall. They have a project where they're really focusing in on families experiencing homelessness. They've had a 90% permanent housing placement rate. It is incredible success that they've had, and they're focused and they're effective. And that's exactly what I'm talking about when I say let's audit the spending that we're having right now, $250 million this year, and the numbers are going up. We have to do better, and our nonprofit partners are having some success, so let's double down where we're seeing that and pull back funding, just like we did at the state budget last year when I was on the JBC. Bring that evidence-based, that data-based budgeting to bear, and we're going to make much more progress. And there's some great nonprofits. We need to double down where we're seeing that great success and partner, because the city can't do it all by itself.
Thank you.
Leslie Herod, when it comes to helping people experiencing homelessness, you have said that the first step is to getting permanent housing is to get into safe spaces. So what happens then if someone says no to all of the safe spaces you offer?
Yeah. Well, I think first it's important to listen to the words that are being used on this stage. I think a lot of folks here, they want you to believe that homeless folks are part of a different population or they're a statistic. But we've got to remember that people are people. The people living on the streets are not just a statistic. They are real human beings. We can't incarcerate ourselves out of homelessness. It won't work, and it's going to cost a lot of money to do so. I don't know how many Denverites want to build more prisons just to house people who just want housing. The majority of people who are unhoused today on the streets, living in cars, and those you don't see, who are couch surfing from place to place, like my sister did when she was addicted, need access to housing. Denver, DPS, and RTD own the majority of vacant lots in this city. We could build permanent social housing, we could build temporary housing for folks, and we can do it today. We can do it now, and we should.
Trinidad Rodriguez, you brought this up earlier, so let's go back to it. Involuntarily taking someone. You want to do that and involuntarily take people experiencing homelessness to a field hospital. What will be the criteria for you to choose to commit someone on a mental health hold beyond that person simply saying, no, I'm good on the sidewalk?
Yeah, it's a clinical determination whether someone is of danger to themselves or others. And that is exactly the idea, is that this is a health question. We would not kick somebody out or arrest somebody waiting in the waiting room of Denver Health. Why would we deny someone these very important access to health services living in the most dangerous conditions and stand by and watch? That is the criminal thing. That is the inhumane thing. And we have the ability to develop a treatment that meets the standard of care, that is high quality and humane. And our ethical burden is high to make sure it's high quality and humane, and that it does actually result in true healing for people, so that they can go on to the large ecosystem of service providers out in our community for a longer-term recovery and healing among those groups. 853 people died on our streets in the last 5 years alone, according to the Denver Medical Examiner's Office. This has got to stop.
I just want to be clear, though. You're coming through the sidewalks. There's no option. You're either getting involuntarily committed into an ER or perhaps arrested, but you're not being left behind. You can't just say no.
No, I'm saying if you're not of danger to yourself or others, then all the other techniques and ways that we do to use to address homelessness. This is in addition to our existing suite of services. This is the gap that's missing.
Thank you.
Intifoy, you've been involved in really tough negotiations about all kinds of different issues over the years as a community advocate. Can you level with us about what is really blocking progress on this issue that maybe is not always talked about? Like, what is the sticking point and why Denver is having such a difficult time with homelessness?
I really appreciate that question. I am a nonprofit leader for a nonprofit that serves the unhoused called the Headwaters Protectors that brings public health and sanitation. That's step number one. The people on our streets right now, there's a big difference between what I call solidarity and charity. There are a lot of people who are coming down and bringing food to the encampments. They don't have refrigerators and they don't have trash service. During the pandemic, the public restrooms were closed. We still haven't built them, and I ran for city council on it 8 years ago. So what did we do? We gathered the arts community together, we brought them out, and we said, yes, we can deliver water to the people, we can clean up the trash, and we brokered a partnership with the city all these years later. I think what it is it's leadership. We talk about scaling these opportunities. I'm so great to hear so many people are talking about this now. I offered a plan during the pandemic to use ARPA money and Save Our Stages money to use unemployed festival workers to scale the outdoor sites and bring stability to people. To answer your question about what do you do when someone won't move, I have direct experience every Sunday helping people move out of bike lanes, away from people's businesses. It starts with conversations. And if you don't get it today, go back tomorrow, because that's what equity is really about.
Thank you.
I'm going to bring in Aurelio Martinez. At a recent debate, you said we have to stop thinking shelters and start thinking solutions. Are you suggesting closing shelters? And if not, how is a shelter not a solution?
The shelters should be used as temporary shelters, because that's what they're for, to keep them out of the street, keep them out of the cold, keep them out of the danger. The solution is getting them out of homelessness. And I think we're all missing the point here. We can't arrest anyone for not committing a crime, for walking on the street, but we can enforce the camping ban by stopping tents and encampments from being on our sidewalks. And that's what we need to do. We need to get a program, part of the Department of Safety, that will have a patrol to go out there and stop tents from being put up before they congregate and become blocks and blocks long. You move them and you direct them to the shelters where they can stay out of the cold, or where they can get food and where they can get what they want. The answer to that is we need to look at assisted living for the homeless. It's here and it's available now today, but it's not widely known. It's assisted living for people that we can take out of homelessness and get back into society.
I just want to back up just a little bit. It sounds what you described is what this administration has tried. So how do you do what you just described and be successful where the Hancock administration perhaps has failed?
That's exactly where I was leading to, and I'm glad you asked that question, okay, because you gave me a little more time. Assisted living. When we talk about assisted living, you think about elderly, you think about disabled. There is assisted living now for the homeless. And homeless that are experienced because they have a loss of income or they got mental issues, they go to these assisted livings and they have a home. They're not under a shelter. They actually have a home where they come home, they sleep, they go out, look for work, and they work. This is what we have to do to get them out of homelessness so they can get back on their feet.
Thank you.
Jim Walsh, you've said that Denver has the money to provide a home for everyone. That suggests you think the issue here is a lack of will.
Yes, I think this conversation should not even begin until we directly confront the idea that our unhoused neighbors are insane, criminal, or freeloaders. Until we confront that idea, we can't even have this conversation. I agree with Lisa, the paternalism here is thick. And the first thing I would want to do as mayor is welcome unhoused voices to the table, the policy-making tables, and ask them what is best for them, what solutions can they imagine. One survey I saw from House Keys suggested that over 90% of people on the streets desperately want housing. So I don't know where this 50% number is all about, but I think housing first has to be any mayor's focus immediately.
Terrence Roberts, as mayor, you said that you would want to dedicate areas for sanctioned encampments with electricity, lighting, washing machine, and dryers. Where would you envision setting up sanctioned encampments, and how many in Denver?
You know, I have to be honest, I don't have that answer. Like right now, we're going to put them right here near the Platte River. But we have plenty of space in far northeast Denver. We have areas near the Platte River. We may have to do eminent domain. This current administration is using eminent domain to displace Globeville, Elyria, Swansea residents to build a legacy project and to build out I-70. We're not only going to do safe encampments because that's the bottom level of housing that's needed. It's good to hear a career politician, Ms. Harrod, glean off of my platform to say we need more social housing. I'm happy to hear her say this. And we've been saying when the career politicians are saying what the activists and community organizers are saying, we know it's time for change in Denver. So yes, we will have encampments that have all of those amenities for people. They will take themselves to those encampments, but we have to focus on public housing. No one's moving from a tent on Colfax and Broadway to so-called affordable housing. Affordable for who? It's affordable for who could pay for it. And our AMI in Denver is too high. This is a middle-class city. We have to fight poverty with our public safety budget.
And I'll just jump in.
So for the money that would be set aside for a sanctioned encampment, you just talked about the importance of housing.
Yes.
Why not use that money towards affordable housing?
So talking about money, so we cannot use our public safety budget to build more public housing. Anybody who's been working in a municipal setting understands this. We need a public banking system. If you look at what Los Angeles is doing, if you look at what New York City is doing, if you look at Philadelphia with their issues on Kensington Avenue, we can install a public banking system in Denver. It will democratize banking in our city, and it will give us extra income for our infrastructure. We need to make Denver a 24-hour city. Studies have shown it is safer for homeless people, it is safer for our law enforcement, and it is safer for violence all around. So these types of things will bring more sales tax into the city, and we can pay for housing outside of our general fund.
We're going to have a couple of quick wrap-up thoughts on this issue before we move to another pressing issue. Leslie Herod, you were mentioned by name. Yes. Terrence Roberts essentially said you ripped off his social housing plan.
Well, and
that was my word. Did you say
I appreciate and respect. I appreciate and respect my good friend Terrence Roberts, and it's Herod, of course, but you know that. But I actually will say that this campaign started by listening to the people of Denver. We hosted a housing salon where we had people present 3 big ideas, 2 hours, transform a city. And one of the ideas that was brought to us was social housing. And I gotta tell you, they're right. It is a good solution. And regardless of if you're a career politician or not, what I will tell you is we know that Denver's next mayor should listen to the people. And the people do bring solid solutions. I'm not going to lie. I've worked with many people on this stage to put solutions in place and deliver for Colorado and Denver. It's not stealing ideas, Terrence. Let's work together on it. Ian, you know I got you. There's so many people on this stage that have great ideas, but also in our communities. But I want to say one thing about this. They want you to believe that sending people into treatment will be like sending folks off to Betty Ford. Trini Rodriguez is right. It is about getting a field hospital together. And as someone whose parents worked in field hospitals, this is not something that we want in the heart of our city for those who are unhoused. It will cost too much money, and I tell you what, that is not a place where you can provide good treatment with good outcomes. We know that. That's a triage place. And where do people go at night? Where do people go at night? There's still not solutions.
Thank you. Let's do the social housing thing right now. We're going to talk about it later, but let's do it right now. So for folks who are unfamiliar with the concept, roughly speaking, it's the idea that the city essentially acts as the developer and is able to develop properties to create affordable housing, other forms of shelter without necessarily having the burden of profit that you have in the private sector. Seattle, just this week, voted on that concept, and it currently is on pace to pass in Seattle, but they don't have funding for it. It's just an idea there. So by show of hands, who here believes that Denver should get into the business of social housing and developing property itself? Hands up high, please.
Is this nobody pays for anything to live in the housing?
No, oftentimes it would be an income cap, like I think Seattle's income cap is about 30%, but just the idea that Denver would get into the development business itself.
Well, but Kyle, are we fully funding the housing?
Seattle's not. I'm interested in whether you're interested in the idea. Are you curious or interested in the idea, or do you think it should be left to the private sector? That's the question.
Awesome.
We're doing that right now with our shelters.
We are doing it.
We already passed the statewide ballot measure last year that will do this. So Proposition 123, which we passed last year, will allow public entities to be the investor in these housing developments, which allows you to take out the profit motive. So instead of dollars going to out-of-state investors at 20% returns, you allow CHAFA, which is the housing authority, to invest in these. We spent 2 years developing that idea, passed it in Proposition 123. There'll now be $50 million a year coming to Denver to do exactly that. So I'm definitely a supporter.
The cost of,
real quick from Thomas Wolfe. We're going to go to a couple other people real quick, then move on to the next issue.
This is horribly flawed. The private sector doing this, the cost is the profits. That's economics 101. For the public sector to do it, the inefficiencies, delays, you name it. This is on the private sector side. They by far and away do the most, and the reason that the profits keep being competed is somebody else wants to do that. There's no force on the government side to bring it to market in a competitive way.
Thank you. So a number of you have talked about how the opioid epidemic is intertwined with homelessness. A number of you have talked about the fact that people who are experiencing homelessness should not be labeled as necessarily having substance misuse disorders. But we certainly know the impact that opioids are having on our community. The state legislature is considering a bill that would allow Denver to create a supervised drug injection site. Similar effort failed at the legislature in 2019. Mayor Michael Hancock was initially on board, then he backed off. Please raise your hand if you support the idea of Denver creating a supervised drug injection site.
We already have one.
You believe that we already have one?
We already have one.
In the sense that the kind that the state legislature would need to approve? Because that would be operating illegally. You're talking about a different type of harm reduction. It's not the type of the supervised injection site that would require legislative approval. And bless you all who kept your hands up that entire time.
This question is for Leslie Herod and Chris Hansen. As state representative and state senator, you will be voting on the supervised injection site bill if it does proceed through the legislature. More than a third of the legislators at the Capitol have signed on as a sponsor. Leslie Herod, you supported this idea years ago, but you're not listed as a sponsor on the current bill. Why is that?
I support supervised use sites. In fact, I actually went with a group from Caring for Denver and some other folks with the Harm Reduction Action Center and others to go see the supervised use sites throughout in Vancouver. I went with my colleague, Senator Brittany Pedersen, and we saw firsthand how they can work, but also ones that don't work. Working with law enforcement in Vancouver, we understood that when you have supervised use sites, it actually provides a lot of information to understand where drugs are coming from, what's in them, but it also, most importantly, saves lives. Saves lives. What we know is that someone is not going to get help when they're looking for their next fix. What they found is that instead, when people use, they're then more open and receptive to then getting treatment right away. Supervised use sites in Vancouver have the use site on the first floor and then treatment up top. And they can help people actually recover. Folks, again, like my sister, who was addicted to drugs and needed that support and that help.
Real quickly, though, if you are supportive of this idea, why aren't you a bill sponsor this time?
So likely when that bill passes, I will be added on as co-sponsor. There are amazing new legislators in the legislature right now that are leading that bill and our sponsors today. I look forward to seeing that bill on appropriations and as it goes through the process. But I've read the bill and I will be a yes vote.
The next question is for Chris Hansen. You're a hard no on supervised drug injection sites. Why is that, and have you talked to folks in harm reduction about this idea and explored alternatives?
Yeah, thank you. I am opposing the bill. I obviously haven't signed on as a co-sponsor, and I have taken a look at some of the examples, the Vancouver site. There's other places that have tried this around the globe, and I think the results have been really mixed. And I think what we have seen work well is what the state has done in places like Fort Lyon, which we are now replicating in a place east of town called Ridgeview, which is stable housing with wraparound services and drug treatment on site. That is what's showing long-term results. And the Fort Lyon results have been really, I think, a great success for the state of Colorado and is a better approach than starting safe injection sites in urban areas.
Have you talked with harm reduction folks?
Absolutely. I mean, there's a lot of advocates that are at the state capitol working on this bill. That's exactly the process that we have. It's great. And this is now my 7th session, as you said. This has come up on multiple occasions. And so I've had lots of conversations about this bill, from trying to look at it from every direction. But at this point, I'm not supportive.
Let's hear briefly from 2 others who were for and against this idea. Lisa Calderon, briefly, why do you support it?
I support it. Well, I'm the only mayoral candidate who co-created my housing homelessness platform with actual unhoused folks. They also recommended social housing and also safe injection sites, which I would like us to talk about as overdose prevention sites. I support it because, again, I haven't just talked to people, I have actually done the work, including people who are struggled with addictions. We have to implement evidence-based harm reduction models that have been proven to work. And continuing to punish people, criminalize people, does not work. There's plenty of data about that. Also, yes, it would be nice.
I'm just going to leave it there so we can touch on a couple other things. Thank you, though. Kelly Bruff, why do you oppose supervised drug injection sites?
It's definitely for personal reasons. By the way, I've had the chance and spent some time touring at the Harm Reduction Center in Denver and trying to understand the benefit. I think, like everyone, I was hoping there'd be large percentages of people who transition into treatment. It was much smaller than I expected. That said, I spent my entire life loving someone who struggled with an addiction. And I know how hard it is to figure out how you love and support someone but not enable a behavior that's destroying them and your family. And I think for me, I struggle with the enabling piece and trying to draw that line. And I think it's a fair conversation for a community to have, not to fight about it, but to recognize this is really hard.
Thank you.